A pleasant morning to one and all. In today's class, we are going to see about the treatment of tuberculosis as the continuation of our previous video lesson. So, myself, Mrs. K. Jansirani, Assistant Professor of Nutrition and Dietetics, SFRC Women's College, Sivagasi. So, tuberculosis, as we all know, it's a deadliest disease which causes a severe impact in one's health. So, as a continuation, we are going to see about treatment today. So, treatment has a very wide range of procedures, and unlike other diseases, tuberculosis have to be treated as a chronic disease which needs a continuous and long term recovery period, and it has to be taken for a very long, and the drugs has to be taken for a very long period of time, which may lead up to 3 to 6 months according to the condition of the patient. So, in first round of treatment, we say it can be treated with the help of anti-tuberculosis drugs, which are the first line medications which has been given to the tuberculosis patients, and the prognosis after the medication period, and the doctors will be telling them to continue the medications for the period of 6 months, which is called as DOTS, directly observed treatment short course, which is a patient who has been diagnosed with the tuberculosis. After certain period of rigorous treatment, he will be put up into the treatment called DOTS, which is a 6 to 9 months course of medicine which has to be taken by the patient on daily basis. After seeing the prognosis is nothing but the monitoring the recovery of the speediness and the nature of recovery of a patient, that is called as prognosis. So, once the patient is put up on DOTS, he has to be completely given with the nutritional support. So, unless we are giving them a proper nutrition, lifestyle modification, hygienic practices and regular follow-up, prevention of other further complications, a patient cannot be completely recovered from the disease tuberculosis. So, the topmost thing in the treatment of tuberculosis after the anti-tuberculosis drugs are the nutritional therapy. So, as we all know, nutritional therapy is nothing but treating the patient or helping the patient for the speedy recovery by means of nutrition and the food intake. So, in that note, we are going to see about the principle of diet for the tuberculosis patient. A patient who is in the recovery period has to be given with high calorie, high protein, liberal vitamins and minerals and very high fluid diet, and also with a very soft diet. So, nutritional management includes the energy supply of the patient should be in a very adequate manner. That is why we are giving them a very high calorie diet. Metabolic rate will be very high. As we all know, tuberculosis patients will be having high fever and recurring fever in many cases. So, and the metabolic rate will be high with the increase in temperature. In that note, we are giving them a very high calorie, that is even up to 3000 calories. So, in other terms, we can tell it as a patient even with the very low weight, we can give them up to 45 to 50 kilocalorie of energy per kg body weight for adults. If in the case of children who are suffering from tuberculosis, we have to give them 90 kilocalorie per kg body weight. And then comes protein. As we all know, any repairment in the tissues have to be done by means of the protein. So, in that way we are going to give them a very high protein diet, which is up to maybe some 1.5 to 2 times more than the regular intake, which is going to be like 80 to 120 grams of protein per day, and which falls like 1.5 to 2 gram per kg body weight for adult, and even up to 3 to 3.5 grams per kg body weight for children. So, any patients, adults or children, whether it be, we have to give them a very high protein diet, and also another thing we have to take Also another thing we have to take into consideration is to give them a good bioavailability of protein also have to be taken into consideration. Protein, a good quality protein in most of the cases will be having high in fiber and hard to digest. So we have to make sure we are giving them a very good quality of protein to ensure the absorption and metabolism, easy metabolism of the protein in their body. Then the minerals, as we all know, minerals do the preventatory function of the body. So drugs interfere with the vitamin D metabolism. The drugs they are going to take for the next 6 to 9 months will interfere their metabolism, especially vitamin D metabolism. So cause decrease in absorption of calcium and phosphorus. So to avoid the further depletion in the mineral settlement in their body, we have to give them a lot of vitamin D, calcium supplements, and so also vitamin D supplement. Hence the liberal supply of minerals and especially calcium should be given for them. In addition to that, calcium can cure and heal the TB lesions, that very minor part of blemishes which has been caused in the tuberculosis, which has been caused in the lungs of the patient. So 1 liter of milk per day also can be given, and iron, which is also another important mineral which is to be given without fail. So calcium and iron phosphorus is also meant for cell regeneration, that is also to be supplied. And vitamins, when it comes to vitamins, we are supposed to give them a very wide range of vitamin A, vitamin C, which helps in regenerations of cells, tissues and fluids, and drugs that interfere pyridoxine absorption. We have to make sure that we are giving them enough minerals that also make sure and manages the depletion by the interfere which is caused by the drug nutrient interaction. So in that way we are going to give them 50 to 100 grams of pyridoxine every day. So these are the general dietary guidelines. Since most of the patients may have poor appetite, appetizing food should be included in their diet. So they don't feel like eating at the right time. So we have to make them a palatable food which increases their appetite and which makes them a feel good eating habit. Consider likes and dislikes of the patient. Though we are supposed to give them with good nourishment, it is also an important factor to consider the likes and dislikes of the patients. Once the patient dislike any kind of food, even they will not touch it because they are already having a problem with the appetizing. So increased intervals, the patient should be given with the extra intervals, that is we can introduce them a mid-evening snack, a mid-morning snack, 2 times in between supper time, like that we can include in their diet. So small frequent meals can be a right choice for the patients with tuberculosis. 1 liter of milk and 3 to 4 eggs also can be given, and 8 choices of different fruits and vegetables to meet the micronutrient and antioxidant requirement should be given. The patient should be given with 3 to 4 servings of fruit, a vegetable bowl in their diet. Fruit, as I told you earlier, foods should be attractive and as palatable as you can make it. So apart from all this diet, nutritional guidelines, the patient has to be advised to be at rest in the maximum period of time. He has to be insisted to take fresh air, and he has to insisted to stick on to the very good nutrients which are the key elements of a fast recovery of a patient with tuberculosis. So this is all about tuberculosis. So in this lesson we learnt about the treatments and especially the nutritional supplements which is to be given for the patient, and I hope this video will be very useful for you all. Thank you.